Today we're going to talk about how your feet might reveal important clues about your overall health, including possible liver problems. Now, before we begin, it's important to understand something. You cannot diagnose liver disease just by looking at your feet. Real diagnosis requires proper medical testing like blood work and imaging done by a healthcare professional. But the body often gives subtle warning signs, and sometimes those signs show up in the lower legs and feet. One thing to look for is small red or brown speckles on the lower legs. These spots can sometimes be related to circulation problems. Since your heart has to pump blood all the way down to your feet and back up again, issues with blood flow often appear there first. In more advanced liver conditions, circulation and clotting changes can contribute to visible skin changes. That said, this can also happen with diabetes, heart issues, or simple vascular problems, so it's not specific to the liver. Another sign people talk about is spider veins, sometimes called spider angiomas. These are small, web-like blood vessels that appear close to the surface of the skin. In chronic liver disease, especially cirrhosis, the liver may not properly process hormones like estrogen. When estrogen levels rise, it can affect the blood vessels and cause these spider-like patterns. They're often seen on the chest and upper body, but they can also appear on the legs. Still, many people have spider veins with no liver disease at all. Dry, cracked heels are another possible clue. The liver helps produce bile, which is necessary to absorb fat-soluble vitamins like A, D, E, and K. If the body struggles to absorb these nutrients, skin health can suffer. Certain B vitamins, including vitamin B3, also play a role in maintaining healthy skin. Severe deficiencies are rare, but chronic dryness combined with other symptoms could point to nutritional imbalance. Some people experience itching on the soles of their feet without any visible rash. In certain liver conditions where bile flow is impaired, bile acids can build up in the bloodstream and deposit in the skin, triggering itching. This itching is often worse at night and can affect the palms and soles. Persistent, unexplained itching should always be checked by a doctor. Swelling in the lower legs and feet is another important sign. If you press your finger into your lower leg and it leaves a dent that stays for several seconds, that's called pitting edema. In advanced liver disease, the liver may not produce enough albumin, a protein that helps keep fluid inside the blood vessels. When albumin levels drop, fluid can leak into surrounding tissues, causing swelling. But again, heart and kidney problems can cause the same symptom. Changes in the toenails may also appear in chronic illness. Some people with advanced liver disease develop pale or white nail beds, and the small half-moon shape at the base of the nail may fade. Fungal infections can also become more common if the immune system is weakened, which can happen in long-standing liver disease. As for foot odor, it's usually caused by bacteria breaking down sweat. However, when the body's detox systems aren't functioning properly, changes in overall body odor can sometimes occur. Still, hygiene and footwear are much more common causes. So what actually leads to liver problems? The most common causes include excessive alcohol use, fatty liver disease related to obesity and high sugar intake, chronic viral hepatitis, certain medications, and metabolic conditions like diabetes. Diets high in added sugars, especially fructose, are strongly linked to non-alcoholic fatty liver disease. Supporting liver health comes down to basics: maintaining a healthy weight, limiting added sugars and processed foods, eating plenty of vegetables and fiber, staying physically active, managing blood sugar, and avoiding unnecessary alcohol and medications. The key takeaway is this: your feet can sometimes offer early clues about circulation and overall health, but they cannot diagnose liver disease on their own. If you notice persistent swelling, unusual discoloration, itching, or nail changes, the safest move is to get properly evaluated. Your body usually gives small warnings before serious problems develop. The question is, are you paying attention?